two drugs can act at the same receptor and still produce very different concentration response curves. One curve may sit further to the left, another may reach a higher maximum. An antagonist may shift the curve or reduce its maximum response. These changes are not merely graphical. Each one tells us something about the drug, the receptor, and the biological system. By the end of this video, you should be able to look at these curves and explain what has changed, and more importantly, what that change actually means. Welcome to Pharma Vault. In this video, we will focus on potency, efficacy, and the interpretation of concentration response curves. These terms are often thought together, but they describe different properties. A more potent drug is not automatically more effective, and neither potency nor efficacy should be confused with affinity. We will begin by learning how to read the concentration response curve. We will then distinguish affinity, potency, and efficacy, examine the behavior of agonist and antagonist, interpret the classic curve shifts, and finally connect graded response with population-based measures such as ED₅₀ and the therapeutic index. Anatomy of the curve. Before interpreting a curve, always read the axis. On the horizontal axis, we usually plot the logarithm of drug concentration. Using a logarithmic scale allows a wide range of concentrations to fit on one graph and transforms the central portion of the curve into a more readable sigmoidal shape. On the vertical axis, we plot the magnitude of the measured response. This could represent concentration, enzyme activity, signaling output, or another continuous biological effect. Each point represents an experimentally measured response at a particular concentration. The smooth line is a model fitted to those observations. This is a graded concentration response curve. It describes how the magnitude of response changes in a biological preparation. It does not tell us what percentage of patients responded. That distinction becomes important later. Reading the parameters. Several parameters can be obtained from a functional concentration response curve. E₅₀ is the baseline response before the agonist produces an additional effect. Emax is the maximum response observed in that experimental system. It is associated with efficacy, although the observed maximum can also depend on the tissue, receptor density, and signaling machinery. EC50 is the concentration producing half of the response range between E₅₀ and Emax. It is commonly used as a measure of functional potency. A lower EC50 means that a lower concentration is required to produce the half maximal response, so the drug is more potent within that particular assay. The Hill coefficient describes the steepness of the fitted curve. However, it should not automatically be interpreted as the number of ligand molecules binding to a receptor. It is an empirical slope parameter unless the underlying mechanism has been established. Binding is not response. Now we reach one of the most important distinctions in pharmacology. Binding is not the same as response. Let us begin on the left with the binding curve. Here, the y-axis represents specific binding, while the x-axis represents the free ligand concentration. As ligand concentration increases, Progressively, more receptors become occupied until binding approaches Bmax, the total measurable binding capacity in this preparation. For a simple one-side equilibrium model, binding is described by the equation shown here. B equals Bmax multiplied by the free ligand concentration divided by Kd plus the free ligand concentration. When the free ligand concentration equals Kd, binding reaches half of Bmax. Therefore, Kd is read from a binding experiment. The lower the Kd, the less ligand is required to occupy half of the available sites, and therefore the higher the ligand's affinity. Now compare this with the functional curve on the right. Here, the y-axis is not receptor occupancy, it is a measured biological response. EC50 is the concentration that produces a response halfway between the baseline E0 and the maximum observed response Emax. A lower EC50 means greater functional potency within that experimental system. The large not equal sign is intentional. Kd and EC50 may be related, but they are not atomically identical. The illustration at the bottom shows why. A biological system may produce a large response even when only a small portion of receptors are occupied. This can occur because of receptor reserve, signal amplification, or highly efficient receptor-effector coupling. In such a system, EC50 may be lower than Kd. So remember, Kd describes ligand binding affinity. EC50 describes functional potency. Occupancy and response are connected, but they are not the same measurement. Let us apply that distinction to two direct comparisons. On the left, we have binding curves for ligand A and ligand B. Both curves approach the same Bmax, meaning that the measured total binding capacity is the same. However, ligand A reaches half of Bmax at a lower free ligand concentration. Its Kd is therefore lower than the Kd of ligand B. Because a lower Kd indicates stronger affinity, ligand A has the higher affinity. Now look at the functional curves on the right. Drug X and drug Y both reach the same Emax, so their maximum observed response are equal in this system. But drug X reaches half of that maximum at a lower concentration. Its EC50 is lower, so drug X is more potent than drug Y in this assay. Functional potency can change between tissues or assays because receptor density, coupling efficiency, and downstream signaling can differ. Also, these two panels are independent schematic examples. We cannot conclude that the ligand with the highest affinity must always be the drug with the highest functional potency. The reading rule is simple. Use Kd to compare affinity on binding curves and use EC50 to compare potency on functional curves. Ligand behavior on functional curves. We can now use functional curves to compare different types of receptor ligands. The dashed horizontal line represents basal constitutive receptor activity, labeled E0. Constitutive activity means that the receptor system produces some activity even without an added agonist. The purple curve represents a full agonist. It increases receptor activity and reaches the highest Emax shown in this particular system. The green curve represents a partial agonist. It also activates the receptor, but it reaches a lower Emax even at a high concentration. This does not necessarily mean that the partial agonist has lower affinity. Affinity concerns binding. The lower plot to here concerns its ability to generate a response in this system. The yellow line represents a neutral antagonist. When administered alone, it does not change basal receptor activity because it has affinity but no positive or negative efficacy in this model. However, it can still prevent an agonist from activating the receptor. The coral curve represents an inverse agonist. Rather than simply blocking the receptor, it reduces constitutive activity below E₅₀ by favoring less active receptor conformation. This difference between a neutral antagonist and an inverse agonist can only be observed when the system has measured constitutive activity. When reading these curves, the plot to height mainly tells us about the maximal observed response. The horizontal position tells us about potency. These are separate features and should be compared separately. Where the second ligand binds changes the curve. Now we introduce a second ligand and ask where it binds. On the left, the agonist and the reversible competitive antagonist both bind to the same primary or orthosteric site. Because the binding is reversible, increasing the agonist concentration can progressively overcome the competition. The small graph shows the ideal pattern. The agonist curve shifts to the right, meaning that a higher agonist concentration is required to produce the same response. The apparent EC50 increases, so agonist potency decreases. However, Emax remains preserved because a sufficiently high agonist concentration can still produce the maximum response. This is described as surmountable antagonism. The qualification reversible matters. If an orthosteric antagonist binds irreversibly, it reduces the number of receptors available to the agonist. Initially, receptor reserve may hide this loss, and Emax may remain unchanged. Once the reserve is exhausted, however, the maximal response can fall. On the right, the allosteric modulator binds at a distinct site, while the agonist may remain bound at the orthosteric site. A positive allosteric modulator, often abbreviated as POM, can enhance agonist affinity, signaling efficacy, or both. A negative allosteric modulator, or NOM, can reduce affinity, signaling efficacy, or both. For this reason, allosteric modulation can produce several curve patterns. EC50 may move to the left or right. Emax may increase or decrease, or both parameters may change together. We should therefore avoid saying that every rightward shift proves competitive antagonism, or that every reduction in Emax proves allosteric modulation. The observed pattern also depends on reversibility, receptor reserve, the biological system, and the particular agonist-modulator pair. 4 classic curve changes. Start with the upper left graph. A leftward shift means that the changed condition produces the same response at a lower concentration. EC50 decreases, so apparent potency increases. This could occur through sensitization or positive modulation, but the graph alone does not prove either mechanism. In the upper right graph, the curve shifts to the right. EC50 increases, so apparent potency decreases. Reversible competitive antagonism can produce this pattern when the maximum remains preserved, but other changes in the experimental system may also shift the curve to the right. Now look at the lower panel. Here, we focus on the plateau rather than the horizontal position. An upward change means that Emax, the maximum observed response, has increased. This may reflect greater system responsiveness or signaling by a higher efficacy agonist. A downward change means that Emax has decreased. Insurmountable antagonism can produce this pattern, but so can partial agonism, receptor loss, impaired signaling, or experimental limitations. So use two separate questions. First, did the curve move horizontally? If so, examine EC50 and potency. Second, did the plateau change vertically? If so, examine Emax and the maximum observed response. Real curves may change in both directions simultaneously, and their shape describes the data. It does not establish a molecular mechanism by itself. EC50 is not ED₅₀. We now move from asking how strongly one biological system responds to asking how frequently a defined outcome occurs in a population. The curve on the left is a graded concentration response curve. The y-axis measures response magnitude in a biological system. EC50 is the concentration producing a response halfway between E0 and Emax. It therefore represents 50% of the fitted response range, not 50% of people. The curve on the right is a quantile population response. Each individual is classified according to whether a predefined endpoint was reached. For example, the endpoint might be at least 50% pain reduction. A person either reaches that threshold or does not. ED₅₀ is the dose at which 50% of the studied population reaches that predefined therapeutic endpoint. In the illustration, 5 people have reached the endpoint and 5 have not. It does not mean that all 10 people experienced half of the maximum possible pain relief. TD₅₀ follows the same population-based logic, but it refers to a predefined toxic endpoint occurring in 50% of the population. This is the crucial distinction shown at the bottom. 50% of a response is not the same as 50% of people responding. Terminology can vary between sources, so always inspect the axis and determine whether the graph represents response magnitude or the proportion of population reaching a defined endpoint.
Therapeutic index. Once ED₅₀ and TD₅₀ are understood, we can introduce the therapeutic index. The green curve represents the proportion of the population reaching a defined therapeutic endpoint as the dose increases. The red curve represents the proportion reaching a defined toxic endpoint. At the 50% level, we can identify the median effective dose ED₅₀ and the median toxic dose TD₅₀. The therapeutic index is calculated as TD₅₀ divided by ED₅₀. A larger therapeutic index means greater separation between these two median population doses. A smaller therapeutic index means that the median effect and the toxic doses are closer together, and closer monitoring may be required. However, the therapeutic index is only a ratio of two median values. It does not show the full overlap between the therapeutic and toxic distributions. It does not account for the slopes of the curves, individual susceptibility, or the specific endpoints selected. Two drugs could even have similar therapeutic index values while having differently shaped or differently overlapping population curves. For that reason, a larger therapeutic index does not guarantee safety for every patient. You may also encounter LD50 divided by ED50 in historical or preclinical discussions, where LD50 refers to the median lethal dose. For therapeutic discussions, TD50 divided by ED50 is generally the more appropriate formulation. Finally, therapeutic index and therapeutic window are related, but they are not identical. Therapeutic index is a ratio of median population doses. Therapeutic window describes a clinically useful exposure range, and that will lead us into the next video. Key takeaways. Let us finish by connecting the main ideas. First, always read the axis. A binding curve and the functional response curve may look similar, but they answer different questions. Second, CALD describes binding affinity, whereas EC50 describes functional potency. They may be related, but they are not automatically equal. Third, potency tells us how much drug is required to produce a defined response. Efficacy concerns the maximum response that the drug can produce in that system. Fourth, reversible competitive antagonism usually shifts the agonist curve to the right, while preserving Emax, provided that sufficiently high agonist concentration can overcome the competition. Finally, a curve pattern is a description of the observed data, not definite proof of a molecular mechanism. So remember, position suggests potency, height suggests efficacy, and biological context helps explain why the curve changed.
Thank you for watching. In the next video, we will move from experimental curves to our clinical drug exposure. We will explore the therapeutic window, dosing intervals, patient-related factors, and the balance between therapeutic benefit and toxicity. I'll see you in part 3.